Hi, Dr. Larson here. I have Alex with me. He is a basketball player. He is a hurdler, a good track guy, and he gets back pain. And he's been with me for a while now. We've gotten him way better. Back's doing good, right? This was last winter. It's now in the fall. So he's gone through all the spring, the summer, and he did really well with his back pain. But he's just started basketball practice now, right? It's like captain's practice type stuff. And he's just getting a little bit of stiffness. So when I muscle test him all the way through, he's doing really, really good. But I've been looking a little bit deeper lately into some of the more spinal muscles, I guess you could say. So I'll show you what that looks like. Because last night he was playing, and he did some extra training afterwards. He did his basketball practice. He did some extra training, and his back was a little bit stiff. And I'm going to show you why that's happening. Again, we've got another dental one, so this really exists. And I didn't even know he had this in until just now, like 5 minutes ago. So let's go. All right, so when I have Alex push his leg just normal now. When I have him use his abductors and push out, he's very, very strong. Okay, both sides, very strong. Okay, however, when I have him stretch his body long, kind of, change his spine, push out, that's where he gets incredibly weak. He can't hold it at all, can you? Push out. It's very, very, very weak compared to not doing that. His lower back muscles are strong, so pull across. Very, very strong. Pull across. Everything is very strong on him, and that's why he's doing so much better. But that stretch long type test, I've been doing more and more work with that and trying to correct those neurological interferences, and that's what we're going after. Now the other thing I was checking with him was rotation. So this one really caught me. So push straight across towards me, and he is extremely weak here. So we're putting his whole core into rotation. He can't do it. Okay, so here's what I found. I said, okay, I've been having all these dental people coming in from all over the place. What do you got in your mouth? And sure enough, he's got a dental retainer in. So he's got one of the wires that's on the bottom that's a permanent thing. So all he's going to do is just kind of tug on that a little bit. You might think, well, what's that doing? Well, your teeth go into your jawbone. And you have nerve fibers in there, a lot of really important ones. Think of biting on something hard when you least expect it. Your mouth opens really quickly because your brain is trying to protect your teeth. So your teeth are actually have a lot of really, really important neurological input to the brain. And this is how our brains work. We have muscle spindles, we have joint sensors, we have all kinds of sensors around the whole body. That input comes up to the brain, and then it processes, and then we have a motor output. So if you're getting incorrect information coming to the brain, you're going to have a screwed up motor output. That's what's occurring. So when he just tugs on that a little bit, it's merely changing the proprioceptive or the neurological input to his brain. So go ahead and just tug on that. So we'll come down here first, stretch long again, push out, and now he's got a tremendous amount of strength. He's a big, tall guy. How tall are you?
6'6".
He's 6'6", you know? Touch on that again, or pull on that a little bit, push out. Good. Now this one, he just about kicked me twice in this already. So push across. Yep, and hold that and push across here. So you can see him immediately you can see it. He's able to really just kind of torque that body and push that hip flexor around because he has full power there. And that's going to be why he gets the lower back stiffness, pain, whatever. It's because he's got that darn retainer in. So this is our fix, right? He's got to get that removed. Most orthodontists don't have much of a problem with that, so he'll just wear like a plastic retainer at night or something like that. And most of them are totally fine because they usually give options on it, right? Did they give you an option when you did it? A lot of people will just choose the wire just because it's easy. They don't have to think about it, but from what I'm seeing all the time, you really want to have that plastic one in just at night, past that initial 6 months, because you're going to see a lot of these things and people don't know where it's coming from, right? So that's why we're making this video, Thanks again, Alex.
Yeah, thank you.
We'll see you on the next one. All right, Dr. Larson here again, and after we shut the camera off, Alex said something profound. He's a smart kid, very smart kid. Go ahead and tell me what you said.
Well, I noticed when I was pushing on the retainer, my body felt in line and I could push really strong, whereas when I'm not pushing on the retainer, I almost felt like my body was limiting me, like it knew it was going to be hurt. So it's just a big difference when you change just one aspect of something like dental or any other input.
Yeah, yeah. So think of what he said there. He said, it's almost like my body was trying to limit itself, and it's exactly what it's trying to do. It's trying to limit you from the activity because it knows it can't stabilize that. So your brain's number one job is survival and stability. So when I'm working with people in my office, I'm trying to find the interferences that are creating the instability. What is driving that process? And he nailed it right in the head. What grade are you in?
Senior.
He's a senior in high school, and he just nailed that one. He said, my body, it's almost like my body is trying to limit me. So I just wanted to put that on video because it was such a profound statement.